At Cook Children's, we've made a promise to improve the lives of every child in our region. Our promise means bringing innovative breakthroughs and family-centered care to all of our patients. We often start with the littlest babies in our Newborn Intensive Care Unit. These babies need specialized care in a warm and inviting place where the whole family can heal together. It gives them a new beginning, the chance to begin their experience as a family sooner.
It's the unit of miracles. I don't know any other way to say it. We have interventions and specialists and procedures that we can do to make the impossible possible sometimes.
My favorite part about working in the Cook Children's NICU is really helping to take care of not just the babies, but also the families that come to us. Whenever a child or an infant's admitted to the hospital, the whole family's admitted to the hospital.
When I take care of a patient, I take care of them as if they were my son or daughter.
I love children. I love newborns, but I also love critical care medicine.
Aside from a baby still being in the womb with the mom, and aside from being at home healthy and strong and thriving, that it's probably the next best place for them.
What sets Cook Children's NICU apart from other NICUs is the fact that it is located in a children's hospital. A neonatal intensive care unit cannot function well without support staff. We understand that every baby is different. We're able to provide subspecialized care for each unique diagnosis. We could not do that without the Children's Hospital, because it's not just the Neonatal Intensive Care Unit, it's the Neonatal Intensive Care Unit in collaboration with the Children's Hospital and a dedicated staff and dedicated subspecialty staff that makes that all come together.
Our NICU is what we call a level 3C NICU. We get many of our babies from other NICUs, and we do that because we have subspecialties. We have the pediatric cardiologist, we have the pediatric surgeon, we have the pediatric pulmonologist, all things that a normal adult hospital does not have. A level 3C means that we can take care of pretty much everything. We have the ability to do ECMO, which is extracorporeal membrane oxygenation. We are the only NICU in Tarrant County that can do that. The other thing that we do is cooling. We cool the babies down and we help to minimize some of that brain damage that can occur. The other thing that we do is nitric oxide administration, and it helps open up their lungs. Those are three things that are very unique to Cook Children's, in addition to having all the subspecialties and all the other services.
Now the room can be configured, the single patient room can be configured to address how ill the patient is. And so as the patient convalesces and gets better, we just change the configuration of the room, but we will not be moving the patient. So it lends itself to less errors when it comes to medications, treatments, and it really is a safer way to deliver complex care.
We designed the NICU not around the nurse. We designed it, number one, for patient safety, and number two, for the family. We designed it for developmental care for the baby.
The patient rooms have accommodations to sleep 2 people. There are storage facilities within the room so that the parents can store all their belongings. Families have access to laundry facilities, shower facilities. We have a family lounge for parents to have time away from the baby to eat or, socialize with other families. There is a lot more just quiet for our patients. It's going to be great for the patient's duration of the stay as far as infection control goes. They will, like I said, be admitted and discharged from the same area.
We have rooms, special rooms that we've designated for multiple babies. So as a parent, all 4 of your babies, all 3 of your babies, all 2 of your babies will be together in the same room throughout the hospitalization. And it really promotes that bonding experience, the family experience, because everybody's excited when there's more than one baby.
The single room unit definitely helps the family bond better. It allows the parents to be present on a daily basis to care for their child. We encourage the siblings to be present so that they can understand that they do have a baby, brother or sister that's in a hospital environment, but it's going to be okay. It allows the family to feel like a family.
Our staff toured many NICUs around the country. We've read every article on single room design to make sure that all those best practices and other people's experiences were incorporated into not only the design of the unit, but the workflow of the unit and the way the care is provided. The administration at Cook Children's has been very forward-thinking in saying these are things we need to do for our NICU to make it the best in the country. And we think we do have one of the best NICUs in the country.
Everyone involved in the care of our patients, they have a certain affinity for babies and children in general. They have a certain calling to be in that population, and I really feel like it makes a difference.
Cook Children's is an amazing place to be. It is the only place I ever wanted to be as a nurse, and I'm very privileged to be an employee here.
I would encourage any parent who knows their child is going to need a NICU to support them, or a parent who's in an emergency situation like I was, to really consider Cook Children's. The physicians are fantastic. The nurses are superior beyond imagination. They are my heroes. Everything about Cook Children's made me feel like something good was going to happen, and it did.
The Cook Children's Neonatal Intensive Care Unit, a place of endless possibilities for new beginnings.